Well, that's a wrap, Tudor.
Yeah, it's a wrap, and I must say it was quite a meeting.
It was.
I think we have great reasons to be happy with what has been presented here and all the science and the networking and the attendance.
Yeah,
Um,
record
and
attendance.
and I'm sure next year it's going
Yeah.
to be even better.
Oh, thanks. We have a lot to build on. What do you think was the most exciting from the plenaries?
Well, for me, the most exciting was Golden Bridge 2
Mm-hmm.
because it's basically it's just a new era in medicine in general. It's kind of beyond even vascular or neurology, or it's man versus machine. It's AI in the complexities of practicing medicine, and it's the Watson versus Kasparov or
Right.
stroke medicine, and unfortunately or not unfortunately, a machine won, but I think that's good for patients.
Yeah.
It's a yet another way to improve patient care, and I think we as physicians will find ways to fill that gap um, to
Yeah,
find
we're
way.
not obsolete
We're
yet,
not
Tudor.
obsolete. I know there's some angst, especially among more junior physicians about that, but I think we're going to find ways to augment and complement the AI part. But to me, that's the abstract with the most profound implications.
Mm-hmm.
If you want a glimpse in what the future will be, the more immediate, concrete, um, profound impact presentations, I think, are a few of them. But I'm going to start. You can take over.
Okay.
I'm going to start with the middle meningeal artery
Sure.
embolization.
Yeah.
Three abstracts, consistent results, uh, very strong benefit of endovascular treatment, whether for patients who undergo surgery or whether for patients that are not planned to undergo surgery. Consistent benefit, and I think this is going to change practice. It's going to be the standard of care now, and it's a moment that is analogous, if you want, with the 2015 moment
Right.
for thrombectomy for stroke. So that has to be up there in terms of impact on clinical
Yeah,
care.
and it was great to see different outcomes, right? Some of them purely surgical needs, recurrence, symptomatic recurrence,
Absolutely.
concordant outcomes, no matter which, was the primary. Definitely practice changing. I'll throw out there Zodiac,
No
right?
question, Zodiac is
Because
also practice
head of
changing.
bed flat while you're waiting, when your patient's waiting for thrombectomy with an improvement of patient outcomes. So that is so easy to implement, free for patients, and something that could be widely and immediately disseminated. The head of bed flat for LVOs.
Agree. And
Yeah.
even though that sounds intuitive, the reality is that I know from my neck of the woods,
Sure.
especially in transferred patients,
Right.
we see them oftentimes coming into the hospital head of bed 45 degrees. And now we're going to finally have level one evidence, good data to support our our requests for keeping these
For
people flat.
flat.
So
Yeah.
I think that's also going to change
Yeah.
practice.
Other exciting things, I would say the tirofiban study for the patients that are not eligible for thrombolysis or thrombectomy. Some early phase data that it reduces early neurological deterioration with 3 days of infusion compared to aspirin. That needs to be replicated clearly, but a really nice reduction in patient deterioration.
Trend,
Trend,
yes,
yep.
and I completely agree. These are patients in whom we don't have
We have
many
nothing else.
options
Yeah.
other than supportive care,
Right.
and even though this was not powered to show a more definitive benefit, the standard ranking at 90 days, although there's clear trends, positive trends in that direction,
Yeah.
the results are very encouraging, and I think we need to see phase 3 trial that
Yeah.
confirms that, and then we have something to offer also to the sea of patients who are not thrombolysis or
Right.
thrombectomy candidates.
Exactly. All right. Well, I'm looking forward to ISC 2025.
Me too, and I'm gonna take a back seat there. I will be able to
That's right.
relax, so that's great.
That's right. Well,
And
hopefully you'll be submitting some
and
science.
absolutely, I will, and I'm sure you will do an outstanding job. I have no doubts that this will be an even better meeting than what was here this year.
It's been great working with you.
Absolutely, a pleasure.
Take care.
Thank you.
Bye-bye. Thank you.